Right now, India is in the middle of a national nightmare. The country is in the midst of the worst COVID outbreak on the planet. They're currently recording over 300,000 daily new cases, which represents 40% of the world's new cases. They're recording 2,700 daily deaths, but health experts estimate that number could be 10 times higher because of widespread undercounting. The health system is completely overwhelmed. Hospitals are turning people away, oxygen tanks are limited, and empty lots are being turned into mass cremation sites. This is a human catastrophe that not enough news outlets in the West are giving sufficient coverage. The coverage typically centers on how the situation will affect the West or how this outbreak will hurt the global economy. There is usually a failure to recognize the common humanity when covering situations in other countries. India recorded its first COVID-19 case on January 30th of 2020, and for the better part of the last year, it seemed like it had dodged the worst of the global pandemic. Lockdowns were enforced, and cases remained relatively low. At the peak of its first wave in September, it recorded roughly 100,000 new COVID cases in a single day, which seems like a lot until you consider India has roughly 1.36 billion citizens. It would be the equivalent of the US recording 25,000 daily COVID cases relative to its own population. For perspective, the US has been over 25,000 daily cases, unabated, since last June. India began vaccinating citizens in January of this year, and declining case numbers led to a relaxing of COVID restrictions. It had seemed like the worst was over. Restaurants, nightclubs, and markets were open back up, and life was seemingly going back to normal. But starting in early March, a second wave was building across the nation. Religious festivals like Holi on March 29th and the Hindu pilgrimage of Haridwar Kumbh Mela had been linked to superspreader events. Prime Minister Modi's government has been on the receiving end of stiff criticism for downplaying the threat of a second wave and even holding large political rallies in spite of potential risks. This episode also shows that no matter how much we want things to go back to normal right now, they cannot until it is safe and sufficient vaccine rates have been reached to develop herd immunity. Inequality in the global vaccine distribution means that it will be some time before India has sufficient supply to meet its immense vaccine demand. Right now, 1 year into this pandemic, it must be humanity against this disease. India needs the help of the international community in fighting COVID-19, as this second, far more deadly wave shows no signs of cresting anytime soon.